Dr. Bill Dorfman is a cosmetic dentist with a long list of celebrity clients. Welcome back. Thank you. You know, Bill, I have to say, I know I'm not as pretty as most of your clients, but I do need a dentist.
I'm there.
Do I fit the bill for you?
I can arrange that for you, Travis.
He's already diagnosing us backstage. He's having me bite down, see if I have an overbite or am I grinding my teeth.
You know you grind your teeth? I'm like, what?
Big time, big time.
Well, we know the right guy. He's right here.
Well, and so many of the things I want to talk about today are salient. First of all, toothbrushes. I just bought a new electric toothbrush. Can I use the old school toothbrush? Do I need to buy one of these really fancy ones?
I like the soccer ball over there.
Well, here's the deal with toothbrushes. The number one, the number one dentist recommended one is Sonicare. Toothbrushes are really a matter of what you do with it. You can use a manual toothbrush and do just as good a job as you can with the electric ones. The electric ones help you. It makes it better, and especially for older people or younger kids that just don't do a good job, you can actually use a toothbrush like this for about 2 minutes and do everything you need to. Now, the average person brushes like 30 seconds. That's not long enough. This has a built-in timer. So there are a ton of toothbrushes on the market. Just get a really good soft one. Don't buy the hard ones. People think if you use the hard ones, it's better. It's actually worse. It brushes your gums away.
Yeah,
you need a really good soft one.
How long should you actually brush your teeth for?
Well, these have a built-in timer, so about 2 minutes is right. There's a lot of debris that you just don't get off with a manual toothbrush, and the electric ones will really get in there and help you clean it.
I'm going to walk away with this one right here.
The rule of thumb on flossing, only floss the teeth you want to keep.
Yeah.
If you're going to use your own toothbrush and not use an electric one, you want to take the toothbrush into your mouth and bring it at about a 45-degree angle and kind of just massage it around in little circles. But you see, you'll still leave a little bit of plaque in there and calculus, so you always want to floss too. And like I said, the electric ones will get them a lot cleaner.
And then the other thing you were talking about before the show is how many germs our toothbrushes can carry. And I have to admit, I look at that toothbrush sometimes and I'm thinking, okay, last week I was sick. Do I still have the viruses?
Throw it out.
Yeah.
If you're sick, just throw your toothbrush away. You should change your toothbrush about every 3 to 4 months. The one thing I love about the Sonicare model is it has a little desanitizer. So you just take this toothbrush off, you stick it in here, and there's a little UV light. You just close this up and hit it. But
so if you're supposed to disinfect your toothbrush,
but if you don't have that, what
week.
can I disinfect the head of my
Just
toothbrush
use
in?
hydrogen peroxide, 50-50 with water, once a week, dip it in there, every 3 to 4 months, throw it away.
Has anybody ever done that to the regular toothbrush?
I have not.
Never done that.
But here's the scary thing,
I'm gonna
people.
start doing it.
You need to take your toothbrush and store it in a clean, dry place or in one of these, and don't put it anywhere near your toilet. Show them why. When you flush the toilet, there's a spray of bacteria that come out, and if your toothbrush is near that, guess where it goes? Yeah. 8 out of 100 men, if they drop the toothbrush in the toilet, will actually rinse it off and use it.
Unbelievable.
Women don't, by the way. Men will.
We have something I want to move on to that's really important today. We're going to talk about gums. Gums health, and we have a guest in our audience, Keegan, who says she's very, very self-conscious about her quote-unquote gummy smile, shows too much of her gums when she smiles. So Dr. Dorfman, you're here to do a special procedure today.
We are.
And Keegan, you're all numbed up, right?
Yes.
Very self-conscious about your smile.
A little bit, yeah.
But are you willing to have something done right
Absolutely,
here, right
yeah.
now?
I don't like my pictures because you can always see my gums, and I have
Why
really
don't you
small
come
teeth,
up with us here, and we're going to do a real-time procedure on you. How you feeling?
Good.
Have a seat.
What Dr. Dorfman is literally going to do is remove some of Keegan's gums so that when she smiles, less of it is visible, more of her teeth are visible. And it's a procedure that takes about 2 minutes, and she'll feel no pain because she's completely numbed up.
Open for me. One of the things Keegan didn't like is the fact, open real wide, sweet, that her teeth were so little. So this procedure will actually allow us to make her teeth a little bit longer, and that way when she smiles, she won't have as gummy a smile. This is called an electrosurge, and it's an electrocautery unit. and it basically just removes the tissue. You don't feel any of this, do you, Keegan?
No, not at all.
Don't shake your head. Just say no. Okay, good.
Not at all.
Turn toward me, sweetie. There we go. We're almost done.
This is a whole new level of going to the dentist, Keegan.
Yeah, on stage.
You never thought you'd go to a barbecue today, did you?
I can definitely smell it.
Yeah. And that's all we have to do. And then, Keegan, what you're going to do is you're going to take your toothbrush and just kind of massage the gums up there. We're done, Travis.
That's it. That wasn't even 2 minutes. That was maybe 1 minute.
I told you I was fast.
Well,
all right, let's sit her up and take a look.
Because what I want to do, Keegan, for you, someone who's been self-conscious about her smile, I want to take a look at your before picture when you would smile, and then we're going to compare it with your new smile that took about 1 minute to create.
Check it out. So first thing we did was we went ahead and we did Zoom. Here's her new smile right here. But look, Travis, how when she smiles, she doesn't have a gummy smile anymore.
You see that?
Yeah, looks really good. I really like that.
And look how much whiter your teeth are, Keegan. And
correct.
just by doing the Zoom procedure, in 45 minutes, we got your teeth 8 shades whiter. We made them about 30% longer. And when you smile, no more gummy smile.
Fantastic.
years,
I'm impressed. I have to confess, I did not believe you when you said this will take 1 minute. I didn't believe you.
I never lie.
Keegan, thank you.
Great.
You look wonderful.
Thank
You
you.
look awesome.